Hi guys, this is Srikumar here, Professor of Pathology, and today we are actually going to discuss some basic concepts on general pathology. A lot of students have actually been asking me the differences between apoptosis and necrosis, and which I have addressed a few episodes ago. So today I'm actually going to focus a little more on necrosis and talk on what is necrosis and what are the types of necrosis. Okay, so necrosis basically refers to a sequence of morphological changes that follow cell death in living tissue, which means the tissue is dead already and there is a sequence of changes that follow that. And now this occurs in any condition where there is irreversible injury only. So if you remember, there are two types of injury, reversible and irreversible, and irreversible is either apoptosis or necrosis, and necrosis is basically a sequence of morphological changes. Remember, there are 5 types of necrosis according to the textbooks. Now the textbooks that I follow usually and which I would recommend for you are for those of you reading for studying for USMLE, MCQs in Pathology by Paras Publishing. This is an Indian publisher. Then quick review and MCQs in Pathology. Again, this is by Harsh Mohan's. It's basically a supplement to Harsh Mohan's textbook of Pathology. And as always, first aid Q&A for USMLE step 1. And textbook of Pathology by Harsh Mohan. This basically comes with this little book, so you can actually read all the basic stuff in this, both general and systemic pathology. And this is a board review series, BRS Pathology. Now BRS Pathology is useful for all competitive exams all over the world, not only in USMLE but also for Indian postgraduate examinations. Okay, so coming back to the types of necrosis. Basically, the types of necrosis would be coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and gangrene. Okay, the 5th type, gangrene, is a mixture of different types of necrosis. So some books classify them as a type of necrosis, some books just state it as gangrene, which is basically a lesion of its entity of its own. Okay, so necrosis basically is a result of 2 concurrent processes. So remember, in the cell and in the cells there are 2 concurrent processes that take place. The first is denaturation of proteins, and the second is enzymatic digestion of the cells. Now these enzymes can be either autolytic, when the enzymes are within the cells themselves, or heterolytic, when the enzymes are in the surrounding tissue and they come into the cells. And since necrosis is a slow process, it takes hours to develop, and sometimes microscopically the classic histological appearance is seen only after around 4 to 12 hours after necrosis has started taking place. Okay, so the first type of necrosis is coagulative necrosis, and in this type of necrosis, denaturation of proteins is the primary factor. In this case, the basic outline of the cells is preserved, so the coagulated cells and coagulated tissues remain the same for a span of few days, and the affected tissues become firm and paler or whiter in color. And the best example of this is in hypoxic death in any tissue except the brain. For example, in a heart attack, in a case of a myocardial infarction, the heart, when you slice the heart and when you see the layers of heart in a case of a myocardial infarction, you will be actually able to see whitish areas of coagulative necrosis. There are many other examples of coagulative necrosis. Remember that in all the cases of coagulative necrosis, there is usually hypoxic cell death and the cells become pale pink, and we call this eosinophilic, okay, which means pink in color, or even acidophilic, and they are anucleate and they remain for weeks actually. Okay, so that was coagulative necrosis. The second type of necrosis is liquefactive necrosis. Now, liquefactive necrosis is characteristic of focal, bacterial, and occasionally fungal infections, and this usually occurs in the brain or in any tissue which has undergone a bacterial infection. Now, going back a few minutes earlier, I told you that coagulative necrosis occurs in all tissues except the brain. That's because you can actually remember it this way. Liquefactive necrosis is reserved for the brain. So it occurs in the brain in hypoxia, where there is a complete digestion of dead cells. And when there is a bacterial infection, these dead cells plus bacteria which proliferate and dying cells all together accumulate to form a liquefied mass. And this liquefied mass is called pus. So what happens when there is a pus? Pus accumulates and the surrounding tissue forms a capsule around the pus. And this capsule is thick and hard. It's because of fibrous tissue and proliferating blood vessels. And this forms a membrane called the pyogenic membrane. And this whole structure of the pyogenic membrane and the pus inside is called abscess. So abscess is nothing but a liquefied material which consists of pus, and this pus is basically cells which are dying, cells which are dead, and proliferating bacteria. And the wall of the abscess is so impenetrable by antibiotics that it is actually difficult to heal once an abscess is formed, and it will end in a fistula or a sinus. Okay, so the third type of necrosis is caseous necrosis. Now, caseous necrosis is basically a variant of a coagulative necrosis which is seen specifically in a particular type of infection, which is tuberculosis. Now, for the Asian population and students in Asia, tuberculosis is a very common lesion, a very common entity which is quite rare in the Western countries. However, since we're all Asian students here, we need to know about tuberculosis. And one thing about caseous necrosis is this kind of necrosis is white and cheese-like, and caseous is derived from the Greek word for cheese-like, so this is called caseous necrosis. And microscopically you have a necrotic focus that consists of fragmented coagulative cells, and it is surrounded by an inflammatory border. Okay, and in this case tissue architecture is almost completely obliterated. And moving on to microscopy, even though I'm going a little beyond necrosis, maybe I need to add here that microscopically, in a case of tuberculosis, in addition to caseous necrosis, you would see granulomas. And granulomas is an example of a form of chronic inflammation where there is a multitude of inflammatory cells which consists of lymphocytes, macrophages, plasma cells, and modified macrophages called epithelioid cells, and some of them join together to form multinucleate giant cells. And in tuberculosis, the type of multinucleate giant cells is horseshoe shaped, and this is called a Langhans type giant cell. Langhans type giant cell is a common question which is asked in many competitive examinations. And the next type of necrosis is fat necrosis. Now, fat necrosis usually occurs in any area of fat destruction. The best example is when you have a patient with acute pancreatitis and the pancreatic enzymes release out from the pancreas because of damage, and they eat into the neighboring peritoneum and the omentum, so you get chalky white areas on the omentum, and this is due to necrosis of the fatty tissue, and the fat is basically whitish, yellowish white in color, so when it undergoes necrosis it becomes chalky white. Okay, the last topic to discuss in this session is gangrene, or some books say gangrenous necrosis, and basically this is a term which is applied to a limb that has lost its blood supply and it has undergone coagulative necrosis. So this is called dry gangrene, and later on a limb that has undergone coagulative necrosis can have superimposed bacterial infection when it ends up with liquefactive necrosis, and this is called wet gangrene. So remember, in wet gangrene, what starts off as coagulative necrosis will lead on to liquefactive necrosis. Okay, so this in summary are the different types of necrosis. Remember a few carry home points. Basically, necrosis is a pathological process, and this is due to irreversible cell injury. Many cells are affected. There is cell swelling, edema, and loss of membrane integrity, and you will find either coagulation or liquefaction. And the neighboring tissue around the areas of necrosis will show features of inflammation. Okay, so that's all from me now for this session. Thank you very much and have a good day.